Hi everyone, good afternoon to my beloved webinar viewers. It is my pleasure to be an MC today. This webinar is in conjunction with World Pharmacist Month Celebration Year 2023 KPJ Healthcare University. I am Liu Chuning, currently a student from Bachelor of Pharmacy and on behalf of the School of Pharmacy KPJ Healthcare University. I would like to extend a very warm welcome to all of you. We appreciate you by taking time off your busy schedules to join us today. We hope you will enjoy the session and also gain a lot of information from our session today. The theme of World Pharmacist Day 2023, which is on 25th of September, is Pharmacy Strengthening Health System. This day has been celebrated since 2009, when it was first created by the International Pharmaceutical Federation to honor pharmacists and their contributions. Pharmacists have an important role in society as they dispense medications, provide advice on drug interactions, offer health screenings, and more. So, World Pharmacist Day is a moment to appreciate the incredible work of pharmacists. Moving on, I'd like to introduce our speaker today, Madam Fareza Hanum Mohammad Radzi. She is a registered pharmacist with 16 years experience as a practicing pharmacist in both hospital and retail sector. Before joining KPJ Healthcare University, she worked in KPJ Seremban Specialist Hospital as the head of pharmacy services, where she managed the operation of pharmacy and related services as well as collaborating with many teams. Prior to that, she also served as branch manager cum pharmacist in various retail pharmacy organizations. Her area of interest is mainly in pharmacy practice. Next, I'd like to invite our speaker, Madam Fareza Hanum Mohammad Radzi, to start her webinar with title Stay on Track Mastering Medication Adherence. Madam, you can start.
Okay, thank you, Miss Liu. All right. Okay. Hi, good afternoon to everyone, to all the viewers. So today I would like to present a webinar on stay on track, mastering medication adherence. So generally, it's about medication adherence. This is basically um, I want to provide a practical insights on and some of the solution for you to improve medication adherence for both the healthcare providers and also the patient. All right. So adherence is not just about taking pills. It's about managing your health effectively. So if you are taking medication, it's not only taking medication, following the guide, following the instruction. It's also about maintaining and achieving the therapy outcome that you want from the medication. Okay. So for today, I will discuss about the difference between adherence and compliance. We usually use the term compliance. Okay, all right. And what are the impact of non-adherence that you can see? Right? And then what are the role of the pharmacist and what are the patient responsibilities? And we would discuss some of the barriers to the adherence, and then we can see some of the strategies that we can do to improve the medication adherence. Okay, so this is the definition of it. Okay, we usually call medication adherence. Some of us call medication compliance. So there is a difference between these two terms. Okay, so basically, medication adherence is we want the patient to follow their prescribed medication regimens. Means that we should have they should follow the correct dosage, they should follow the timing, the frequency, and also the duration of treatment. Means adherence here, you want patient to receive the full therapeutic benefit of their medication and also to achieve the desired treatment outcome. So adherence here, if you see, is not only following the instruction, because we want them to follow the duration of treatment. Means that they have to be able to commit to the refilling of medication. Okay, so that is what we mean by adherence. It's a whole the whole full full adherence to the treatment plan. Okay, so here this is the difference between adherence and compliance. So in adherence, patient must be actively involved in the treatment decision. They should know about their medication, right? They should understand the importance of their medication, of following the instruction, following the treatment plan, and must be willingly to follow the regimen. Okay, so this is their commitment, this is their own choice. But if you see the compliance, it's just like a one way interaction. Okay, you expect the patient to passively obey the instruction of the healthcare providers. So means that probably they don't understand why they have to take this, why they have to take this medication, why their medication is changed, right? Maybe the doctor modified their treatment plan. Okay, so they don't know that, but they are just following the instruction. So we don't want this one way of thinking lah. That when you are given instruction from the doctor, you have to follow. So we want them to also involve in the decision making. Okay, all right. Okay, so why adherence is very important? If you see the problem that we can face due to non-adherence, so this is one of the study that was done in Malaysia. The prevalence of low medication adherence is 34%. So means that 34%. This is quite new, quite recent. It's 2022. So 34% of patients did not adhere to their medication, did not follow the instruction, did not follow the regimen. So this would cause a lot of things within the treatment itself, the disease progression itself, and also maybe there is more incurred cost to it. So if you see, there's one study done in 2023, 1 in 5 older adults reported cost-related adherence. Means when cost-related adherence means they don't take the medication because of too expensive. They don't have enough money to buy the medicine, for example, like that, right? So you can see also from the graph, it shows that cancer drugs is the most medication that cause non-adherence. Okay, probably because it's expensive now, right? So, but if you see from the list, respiratory is one of the drugs that actually have high non-adherence. Okay, so respiratory is quite common. It's like antihistamine, it's like your asthma drugs. Okay, so that would be one of it lah, that actually cause non-adherence. Okay, from this you can see some of the impact of non-adherence. Yeah? So non-adherence usually cause you to have like frequent emergency or hospital admission, right? Because you're not following the instruction of your medication, so the treatment is not enough to help you stay to stay healthy. All right. So what this is cause because of the worsening health condition, it will also increase your healthcare costs. Okay, you have to pay more for your admission. Okay, we have to use healthcare also have to use means the hospital also have to use a lot of manpower to help to maintain, to sustain you, right, from these complications, right? And then this uncontrolled symptom, this uncontrolled maybe attack, okay, suddenly attack, and also intervention that we have done, this also would actually reduce your quality of life. Okay, you are not happy um, with your life. You have to stay in bed all the time. You have to come up with a lot of money to pay for your treatment, right? And in another way, all right. So non-adherence can also lead to inadequate disease control or disease progression. All right. So when you have like chronic condition like diabetic, like hypertension, okay, this can cause a lot of serious complication. And when you have a non-adherence, it will also reduce the therapeutic effect of your medication. So when you have a reduced efficacy of medication, a lot of things came in here. Because it's not effective, all right? Okay, so for some infectious disease, for example, if you are non-adhered to your medication, it will cause like development of drug resistance, all right? So making the treatment more challenging. And in some also contagious disease, non-adherence can lead to outbreaks or spread of infection within the public, within the communities. So this is public health risk lah. So these are some of the non-adherent impacts. Probably we see only the impact to us, but we don't see the other way, the other point of view. All right. So what is the role of pharmacists? Okay, this is very important. We are the custodian of the medication. So it is our job, our role to give a lot of information to the patient. All right. So generally, you want to tell the patient about the medication, how to take it, what is the purpose, what is the side effect, how to avoid this side effect, how to avoid drug interaction, something like that. Okay. And you must make sure that you can give clear instruction. Clear instruction means not simply one tablet 3 times a day, right? You must to make sure that the patient understand your instruction. What does 3 times a day means? When to take? Yeah, right. So whether you want to take it before or after meal, right? So when is before, when is after, right? So you have to make sure that they understand this, and then you want to address their concern. So usually patient will have like problems with how to take this medication, when to take this medication when they are, for example, we puasa time, okay, when they are working, so they need to know when to take this. So you have to provide the reassurance and also the guidance to the patient. Okay, it is also our job to monitor the adherence, okay, so that we can track their history of medication, what are their adherence record, whether they are adhered to it or not. So in the hospital, usually we have our way of monitoring the adherence. So for community, probably we use patients interview. We have to rely to the what the patient tell us. So that is how we monitor the adherence. Okay, so that when we know whether the patient is adhered or not, we can intervene where it's possible for us to intervene, right? Okay, and one of it, we need to do medication reviews. Okay, medication reviews. So if we have this regular medication reviews, this can help to ensure that the treatment plan that was given to the patient is appropriate or not, is working or not, effective or not. Okay, so this is where we can suggest to the doctor whether adjustment is needed, right? Okay, so not only the pharmacist, the patient also will have their responsibilities. Okay, so the patient must understood their significance of their medication. Okay, they need to know about their medication, because when they have knowledge, this empowers them to take their health seriously. Okay, they will able to adhere to their medication. Okay, patients should also actively communicate with the healthcare providers, either with their doctors or the pharmacies. Okay, they must be able to communicate if they experience like side effects or any concern, any difficulties to take their medication. Okay, definitely they have to follow the instruction. Okay, they have to follow diligently. Okay, and they have to know that what is the right time to take the dose, not skipping any dose, and finishing entire cost of the treatment. This is very important. Okay. Sometimes, for example, lah, like antibiotic, we have to inform the patient that they need to fully finish the course. Okay, so that we want to make sure that the infection is fully stopped. Huh? If not, they will. For example, just now we say probably drug resistance will increase of because of that non-adherence to the medication. Okay, one of the responsibility of the patient, we want them to keep their medication record, at least to know what is their drugs, what is the purpose of the drug, what is the dose of the drug, okay, the schedule. This is actually helps to prevent accidental overdose or misdose for the patient. Okay, and if they encounter any issues upon adherence, for example, like financial barrier, they should be able to talk to us lah, to seek help, to know whether there is a solution for this. Right. So let's see what are the common barriers to adherence. So here we will discuss what are the common barriers, okay, and some of the solution that we can see for improvement. Okay. Okay. So the first barriers would be forgetfulness. This is very common, okay, especially for elderly, right? Medication, usually they have a lot of medication, and this medication needs to be taken multiple times a day. So there is 3 times a day, there is twice a day. This is to be taken at in the morning. This is to be taken at night. Okay, so did would cause them to be confused, maybe forget what time, what to take, which to take, right? So the impact would be treatment inefficacy and also disease progression. So this is what we don't want, especially for elderly. It would be it would lead to like complication if you don't follow the prescription. So what we can help them as a pharmacist, we can have medication organizers or reminder apps. This is something that we can recommend to them, we can do, help them. Okay, so for reminder apps, we have a few apps in the market which we can download. Okay, but this app is customizable. Okay, you can customize to the need of the patient, but to use this app, probably you need to be tech savvy lah. You need to know about technology. You need to be proficient. So maybe like older generation, probably they are lacking in this. Okay, so probably they will need somebody to guide them, right? So it's easier for you to help these elderly people using their mobile alarm, right? So there is features like snooze option or medication notes that you can add in the mobile phone. So this one can be used to remind them during what time they need to take. So what we can suggest to them is to have their mobile phone near to them. Okay, if they are going to the kitchen, the mobile phone should be in the kitchen. If they are going to sleep that time, the mobile phone should be next to them, to next to the bed. Okay, so this is one of the thing you can help with forgetfulness lah. Okay, there is pill organizer. You can find this pill organizer anywhere, right? So you can get this. That comes in various size, and this actually help the patient to keep track of their medication dose. Okay, uh, when when they are using it, it is best that you look at how they organize the drugs. Okay, how they mix the drug. There are certain drugs that cannot be mixed together in one. Okay, so this is your job. This is where the pharmacists come in. They have to monitor how they actually organizing the tablet, whether the tablet sometimes they keep for too long in the medication, the pill organizer. So probably there is a lot of damaged, broken pills that you have to that would be in concern lah. So you have to make sure that all the pills are good, right? And then if you go to the um, retail pharmacy, some of them also offer those packaging system, okay, where they combine all your drugs that you have to take during the day. They have this in individual pack. So what the information is there, the name, the medication, the time it should be taken is there. So the responsibility of the patient is only to open the pack, take the medication, just follow accordingly lah. So morning, lunch, dinner, okay, and supper, okay, or that time, okay. So they will help to arrange all this medication in that pack. So this would help the patient very much, especially for elderly patient. Okay, all right. So there is side effect, one of the barriers that can prevent the patient to take to follow the instruction of the medication. This can side effect can be uncomfortable and maybe intolerable for some patient. Okay, and this would prevent the patient from taking the medication lah, because they are feeling they have that fear, feeling worse or experiencing discomfort when they are taking the medication. Right. So this one, sometimes we cannot avoid this. Okay, this is some of the side effect. Not common, sometimes very rare, but there is a patient who will have this type of side effects. Okay. So what we can help them is, first we help them to identify the common side effect, all right, and see whether we can suggest any alternative towards the medication, all right. So generally, we can see a difference in individuals. Some patients may experience the side effects, some others may not affected, right? So what we can clarify to them is that if you have side effect, doesn't mean that the medication is not working. Only probably you are more sensitive to it, all right? So if they can bear the side effect, then it should be all right lah. If they cannot, probably we have to think of another alternative for the medication. Maybe we can alter a bit the dosage with the approval of the doctor, right? Okay, we have to discuss it with their with their prescriber, right? Maybe in terms of changing the timing of dose, right? This would help to apa, for them to comply with the instruction. For example, if the drugs is causing them to be sleepy, okay, so should we recommend them to take this in the morning or at night? Right. So we can discuss that with the patient. Sometimes the timing also because they are not working as usual. For probably they are working, they have a night shift. So we have to change according to their working shift. Okay, all right. And okay, prescribing a different medication within the same class or fewer side effect. This is some of the alternative that we can find lah. Okay, so if we do have that alternative, right? So probably this would be a better suggestion for the doctors. Maybe you can recommend this to the prescriber to change the medication. Okay. Okay. All right. Okay. Okay. So the third common barrier would be complex regimen. Okay. So many medication, multiple medication at different time of the day and with specific condition like to take with food or empty stomach. Okay. This can be overwhelming and also confusing and lead to dosing error or non-adherence. Okay. So too much, too many medication makes everything is confusing. They see a lot of colors, pills, syrup, injection maybe for them to take. Okay, so this one we have to help them with to simplify their regimens. Okay, this is would be a good um, uh, role that we can show the patient lah, where we can help them to manage the medication. Alright. So if you see from the picture, we have actually many combination pills available in the market. So this is something that we can help the patient. We can help also the doctors to prescribe better regimens to the patient. And these combination pills usually have many types of formulation. Okay, so how they release the drugs. So they have 2 or 3 drugs inside one tablet. So easier, instead of taking 3 tablets, they are taking only 1 tablet. And usually this type of medication comes in a control release or sustained release formulation. So where the drugs is released from the tablet uh, uh, bit by bit lah for the whole day. So 1 tablet can cover the dose for the whole day. So it's better for the patient, right? So condition, usually combination pills are used for condition with like diabetic, chronic condition lah, diabetic, hypertension. Usually they have this type of combination pill, and patients should be able to discuss with their healthcare provider if this type of medication is available and suitable for them. Okay, maybe some of the medication dose is not suitable for the patient, so they have to discuss whether this is okay or not. So patient are not advised to change on their own. Okay, please get that advice from the prescriber or from the pharmacist. All right. Okay, for complex regimen, okay, some hospital or pharmacy also have this type of medication label. Okay, during my time also we have this type of medication label for the patient to be able to identify whether this medication should be taken at what time. Okay, whether this medication should be used um, for what purpose. Either sometimes the ear drop, eye drop is similar looking, right? Okay, so they would like to know whether this is for eye or for ear. So we have that sticker label that shows this is for ear. So patients should be able to identify that lah on their own. So some patient maybe they cannot read properly, they have to rely on these images. Okay, that would help them so much lah. Alright, so this type of label help them to organize the medication by day, by time, and maybe by the administration purpose lah. So the correct route of administration. Okay, so this label actually helps much to reduce the risk of error. Okay. Okay, right. So we also have still the medication tracker organizer. Okay, instead of just using a pill box, we can also have a tracker type of pill box where we can press the button. If we have done for that dose, we can press this button. Okay, this is the whole look of the medication medic pack that I've discussed previously. Okay, where patient responsibility is just to open the pack, during what time they have to use the whole pack or the whole medication inside it. Okay, all right. So the fourth barrier, okay, would be about the cost. So this is quite common, okay, especially for those without the insurance or without with high deductibles in their expenses. Okay, so these people may skip doses or maybe reduce their dosage to save money. Okay, so I can see this a lot in community. All right, so usually those people with many how to say tanggungan lah, anak-anak they usually do this. Okay, reduce the dosage, right? And then this actually can compromise their treatment effectiveness, right? So later will lead to complication, especially on for elderly. Yeah? All right. So what we can do for them is maybe we can discuss any alternative, generic alternative that we can suggest to them, and if they have any assistance program that that they can look into lah, right? Right. So what we can recommend generic brand which is more affordable with same efficacy and safety. So for example, like what we show here, we have Panadol. Maybe the price is higher than just a normal generic paracetamol. So this it's more affordable, the same efficacy, same safety profile. Okay, so this is something that you can look into when you are recommending to your patient. And if your patient is not cannot afford the drugs, so what are the alternative that available for them to take? Okay, all right. Some country also give financial assistance on medication, but probably I think in Malaysia we don't have such things lah, except you have like insurance or maybe your company health benefit or subsidies from the government. All right. So this is what in Malaysia we have, but some other country we can have this Medicare and Medicaid to help them with their medication, to help them with the treatment, the treatment plan of from the doctors. Okay, okay. So those plan usually they have their own eligibility criteria. So this is what we should discuss with the doctor. Okay. So one of the, if you see from the four barrier that we discussed just now, basically more on education we have to emphasize. All right. So medication education is part of our role as a pharmacist. All right. We need to be able to provide provide the information so we can actually tell the patient they need to be consistent in their medication adherence. Okay, they cannot just simply skip dose or change their dosing, their frequency. They cannot just simply do that. Okay, so that's why it's important for us to communicate with the patient so that we know their schedule, what are their routines. Okay, so how actually we can incorporate the schedule, the medication schedule into their daily routine. Just now I told you about if the patient is working night shift, so how we can adjust the medication schedule into their routine. Okay, all right. If they have any concern or question about the medication, we should be able to address this concern. What type of concerns usually they would ask about side effects. Any interaction, probably this is something that we have to detect, right? If they would like to know whether uh, they have if they take this medication, okay, can they do any activities, other activities? Okay, so this is some of the concern that you may get from the patient. So you should be able to address all this question. What they usually need is actually guidance and reassurance only. Okay, um, it is important also for us to clear the myth and misconception of medication. Very important. For example, maybe, for example, like people always think that antibiotic can help all problem, all infection. So is it true? Is it is it okay for you to take antibiotics? Will it cause any other complication later? So this is what we need to explain. We need to educate with the public. Okay. Medication are addictive. All medication have side effect. So how we want to reassure them that this side effect is common, but it's actually depending on the individual itself, whether it will, how we can help them to address their concern on this. Okay, and one of the misconception that I always receive lah during my tenure in retail is about insulin. People thinks that once you take insulin, you cannot stop. All right, this is quite common. So this is some of the myth and misconception that we need to clarify with the patient. Okay, all right. Okay, so if you see here, I've shown one of the study. Actually, when we have this pharmacist involvement in educating the patient, we can see a lot of different in terms of their clinical parameters, and also their how to say perception on pharmacies. All right. So we see that when we involve in their medication therapy, for this one is you can see the outcome of the diabetes medication therapy is better. HbA1c, fasting blood glucose is going down. Okay, so this is what actually the benefit that we want from the medication education that we give to the patient. Another part of pharmacist role would be the effective communication with the patient. The patient provider communication. Okay, we have to have this good rapport with the patient. Okay, where we can make them feel comfortable to tell us things. Okay, to discuss their concern, to ask question, to share their experience with their medication. And we should be able to actively listen to this concern and address them. Okay, so it's not just only listening, but we have to take action upon it, upon the complaints or the apa, the feedback. Okay, all right. And this would also important for us to have that active patient participation. Okay, we want them to be able to express their preference. We want them to be to be informed, to be informed about their medication, and ask question about their treatment plan. So we can have that two-way communication lah, right? One of the important thing that we should actually do lah in our role as a pharmacist, this medication review. I would agree that every pharmacist should do this, even if you are in the hospital or you are in the community, right? So you should have this medication review. What you can do is ask the patient to bring all their medication, look at the medication, whether the medication is still okay for them to take, expired. Maybe you have like a polypharmacy, maybe you have like multiple drugs, same brand, so not same brand, same medication, different brand. We do find that in community, all right? And we help to assess the treatment plan, whether it's effective or not, whether they have side effect or not, any issues or not on their medication, and also we can make necessary adjustment. So it's important that we do this. We perform this role, especially in the community. I would think they would really appreciate that that help with the patient. Okay, there's one part of adherence that we can really take care of is about special population. All right, we need to consider adherence for the children and elderly, especially. Okay, so for the children, you will have like factors like taste of the syrup. Maybe they cannot swallow pills, or maybe there is a need for slower formulation. Okay, some children they don't like the taste of the syrup. Okay, taste like paracetamol syrup. You have like suspension, taste like kapo, like that, right? So children don't like that. Children usually don't like that. And maybe the flavor of it, the orange ke, strawberry ke. Some children like strawberry, some children like orange. So you should consider this when you are prescribing to the patient. All right. Some children they don't like syrup. Every time they will vomit. All right. So they don't want any syrup, but they can take pills. But you have to look at whether the size of the pill is suitable for them or not. Like my son also, he don't like to take syrup. Always I have to give pill cut in half. then he can swallow. Okay, he can swallow. So then okay, the treatment receive the treatment lah, instead of all time vomiting, right? Okay, so whenever the doctor prescribe me um, antibiotic syrup, definitely he won't take. So how to get apa, to get healthy lah, right? To heal. So that's where we come. Even us as a pharmacist, we can actually help the doctor to give a better formulation for the patient, right? The need for each appropriate formulation. Okay, some, if patient cannot take syrup, what are the formulation available that we can give to the patient? For example, like suppositories, right? We can change that, right? Okay, for elderly, mostly about confusion, mostly about dosing error, some may cognitive changes, right? But you have to also think about their physical, their ability to open the bottle. Okay, this is something that you need to know. Sometimes we give medication, the medication they cannot even open the bottle. So they have like apa, macam childlike protection with bottle kan. So if you give this, definitely they won't take the medication because they cannot open. But if you give the medication in a regular pill box, it may cause the medication maybe deteriorates faster. So what are our choice to help the patient? Okay, so we have to think about this. Okay, right. Involvement of caregivers. Okay, some, this one usually relates to the elderly lah, right? So we need also to teach the caregivers how to take the medication, how to give the medication to the patient, and also how to actually handle the storage of the medication and everything. So all the information should be given to the caregivers lah, instead of the patient. If you give to the patient, they cannot also remember. So the most important thing is their children and also other caregivers lah, if they have nurses ke, that help them with that. Alright. Okay. So what else? Alright. Okay. Oh, all right. So I have come to the end of my talk actually. So what I can put as a take-home message, okay, medication adherence is essential for you to achieve optimal health outcome. Okay, and one of the barriers would be forgetfulness, very common side effects, very common complex regimen, and also costs, right? So this would actually leads to the misdose and compromised treatment. So what can we do to actually help the patient? And what can the patient ask us about it? So sometimes they don't know what to ask. So if they are openly communicate with us, then we should be able to detect some of these issues. Okay, all right. And very important, accurate information helps the patient to make informed decision about their treatment. All right. Okay. So here just some encouragement lah, we would say. So for the patient, your health matters. So this you have to know that your health is invaluable. So you should be able to have a better control of your condition, your symptom, your relief, and also your quality of life, right? So the patient should understand this. Okay, and you should be able to partner with your healthcare team. So your healthcare team would be your doctor, maybe you have your nurse and pharmacist. All right, your family also would be your healthcare team. All right, so you should be able to openly communicate and share your concern what about your medication. All right, you can set your achievable goal. So you have your organizers, you have your reminders. So if this would help you to overcome the problem, the adherence problem, so this would make big difference in terms of your health outcome. All right, so this small step can actually make a big difference. And if you have these successes, okay, achieving better health outcome, no symptom for the whole week, for example, because you adhere to your medication. So you should celebrate this. So later on, you can set better goals to have a more significant achievement lah in your well-being. Right. And this patient should be able to seek support. You know you are not alone. So many of patients also have the same problem, but you should be able to seek support. You should reach out to your healthcare providers and ask for guidance for support on your issues, challenges on your medication regimen. Okay. So for the pharmacist, you should know that your expertise, your guidance actually impact the patient outcome. All right. So you play a vital role for the patient to understand the medication, to how to take the medication, what are the importance of adherence. And this actually give you the power to give the empowerment to your patient, okay, to take control of their life, of their health, okay. So for that, for them to be able to make informed decision on their medication and overall well-being. Okay, so um, emphasize to the pharmacist also. Okay, that you are able to have to get that positive outcome. You will be happy that when the patient comes to you, tell you that you have made a difference in their life, contribute to their improvement of health. Okay, so you would be very happy, and this is like a motivation to us lah, to help other patient, to prevent any complication, to prevent any further hospitalization because of their disease, or something like that. All right. And encourage also, I would like to encourage also all the pharmacists to continually find updates on latest advancement in medication, so for you to be able to reach out to your patient, so have a better support to your patient. Okay, so that would be the end of my presentation. So thank you for lending me your ears. So if you have any question, I would have happy to answer. Okay.
Thank you, Madam Fareza. That's so informative. I believe that our viewers will learn a lot from you. Now, viewers can type your questions in the comment section of live chat in the YouTube if you have any doubts. Meanwhile, while waiting for the questions from our viewers, Madam, I have some questions. How do we ensure the medication adherence? For example, if some patients feel that their symptoms already relieved after taking the antibiotic and then refuse to complete the full course, how do we ensure and suggesting them?
Okay, that is common actually, right? Because they don't feel ill. They say, okay, no need to take the medication. All right, but we have to tell them about the importance of they finishing their course. Like for example, you you have to, okay. Sometimes pharmacists have to be very creative in explaining things to patient. Okay, uh, you have sometimes we say we cannot tell things that would fear we make the patient afraid of taking medication, but sometimes we do have to tell what are the complications if you don't take this medication, how would you feel if you are sick another time. Okay, kalau you sakit lagi the next time macam mana, whether that medicine will help you or not. Okay, and what is the implication after that. So if you are ill next time, would this same medication help you, or you need to take more expensive medication? Which one would you like? Okay, so sometimes we have to do that, to make sure the patient understand the importance of taking or finishing the course. All right, so if you have this type of patient, it's better for you to be able to how to say, follow up. Okay, you have to follow up maybe every 2 or 3 days. 2 or 3 days you have to call again the patient. Usually patient will take continuously like for 2 or 3 days, then after that they feel, oh, I'm healthy already, don't need to take. But you have to finish maybe another 4 days, right? 7 days minimum. So maybe you can call them. Okay, get them to understand. Okay, kalau dah sihat pun kena makan lagi. Okay, so kita nak make sure apa. You have to tell that to the patient. Okay, this is, I mean, the initiative of the pharmacist. You don't have to do, but if you want to help the patient, you do that on your own. Alright.
Thank you, Madam, for
Okay.
a clear explanation. I see some questions from our viewers. First is, Vicky asked Madam that are there any additional resources or support you think would help you improve your medication adherence?
Okay. So resources and support. Okay. Resources usually you can give like medication leaflets, right? Medication leaflet or disease leaflet. Some of the hospital they have this disease leaflet. Actually, how we manage disease. So community pharmacy also can do this, and we have a lot of support group also for medication adherence, right? Especially for the chronic condition. Okay, if the hospital they usually do this MTech, MTech. It's like a support group. It's like an educational group. So these patient can contact each other, can form a group where they talk about their medication, whether it's okay for to take this medication like this or to to adjust the dose. Some diabetic like insulin, you can adjust the dose. So they can get guidance from other patient also. Okay.
I believe that Madam answered the question.
Mm-hmm.
Sekarang ada lagi soalan daripada Jahui.
Mm-hmm.
Adakah itu keberkesanan ubat kepada pesakit akan berkurangan sekiranya pesakit mengambil formulasi ubat yang berbeza? Contohnya seperti suntikan akan memberikan keberkesanan yang lebih tinggi berbanding bentuk tablet. Tetapi disebabkan permatuhan pesakit, bentuk tablet diberikan untuk memastikan pesakit mematuhi ubat.
Okey. Yang ini kalau suntikan, ya betul. Dia akan bagi keberkesanan tinggi sebab you inject terus pergi ke our systemic system, okay? Dia terus pergi ke tempat yang sakit. Alright? Tapi kalau tablet, you makan, masuk dalam perut, baru nak proses pecah baru nak masuk. Okay? It takes longer time. Alright? So, injection, ya cepat. Okay? But some patient, yalah, you nak pergi inject, kadang-kadang you tak boleh inject sendiri. Like subcutaneous, baru you boleh inject sendiri, betul? Right? So bila you inject, itu pun kadang-kadang ada patient boleh, ada patient tak boleh. Alright? So sometimes some patient they prefer oral juga makan. Okay? So if you give tablet, okay, probably takes a longer time, but I would say the effectiveness will be the same. Alright? Maybe frequency of taking lebih sikit. Instead of just once a time, once daily, macam injection mungkin once daily saja. Tapi yang ini maybe you kena ambil 2 atau 3 kali sehari. Okay? Tapi the effect would be the same. So I don't think it's issue lah. But as long as we can get the patient to take the medication, itu pun dah cukup baik. Alright? Okay. I hope that answer your question. Okay.
Lagi satu soalan. Sesetengah pesakit mempunyai tangkapan yang salah bahawa ubat-ubatan diperbuat daripada bahan kimia yang mereka merasakan ubat-ubatan herbal menyebabkan kesan sampingan yang kurang kepada mereka dan dalam jangka panjang mereka tidak mematuhi ubat. Madam ada apa cadangan atau cara yang boleh mengatasi isu?
Okay. Ubat herbal memberikan kesan sampingan yang kurang daripada yang chemical one. Is it itu maksud dia? Betul? Betul kan? Okay. Okay. So this actually depends on the belief of the patient. Some patient dia lebih suka herbal type. Bahan-bahan dari tumbuhan ni lebih selamat berbanding dengan chemical lah. Alright. Okay. But for this type of patient, okay, you have to make them understand, okay, if they are taking herbal type, they should know what is the content of the herbal. Alright. Some herbal medication, they have a lot of ingredient. Alright. Which also probably if you take chemical, there's only one chemical ingredient, but when you take one herbal medicine, you can have like 5 chemical ingredients inside. Okay, and these chemical ingredients will react differently according to our body. Okay, so this is what probably in those 5, the dosage is not enough for them to achieve the apa the therapeutic outcome that they want compared to one chemical. So some patient they would say they have they achieve better effect lah, but from the herbal, but they would develop something else from the side effect of other ingredient that they may not know. Okay, so that one is very important also, because sometimes we for a pharmacist this is a very crucial role for you to actually see whether the drug interaction is there or not. All right. So when you have a patient who like to take herbal and also taking medication, you need to be able to check for the interaction. Okay, I would say definitely you will find one or two interaction there. All right. So this is where our role is very important. So when you told them this is what happened, this is the information is this you taken from our record or something. Okay. So I would think they would understand that, right? So but you cannot I mean prevent these people to take herbal. Okay, some herbal is good, but you have to be careful in terms of the dosing lah. Okay.
Alright. Alright, it looks like we have covered all of our questions. Madam, do you have anything to cover before our recapitulation?
Okay, I think I have given the my thoughts, my sharing my experience, my knowledge on this part. So for me, it's important for you to understand your own role. Okay, what can you do for the patient? Don't think what the patient can do for you, right? Okay. Yes, patient come to you, ask you some advice, buy things from you. If you are in the community, buy drugs from you. But what actually you can provide to them? Okay, other than advice, other than support. All right, what type of support? What can you do to make a change in their life? Okay, that is what you need to understand, to think about. Right?
Again, thank you, Madam Fareza, for this informative talk. Also, I'd like to thank each and everyone who joined us and for making this webinar happen. All of you taking time off your busy personal schedules mean a lot of us, and also our committee members. We hope to see you all in the upcoming events, and we appreciate you being there. Thank you everyone for attending this webinar and also our previous webinars. Have a great day. Thank you for joining us. Bye bye.